Hi, my name is Dr. Jeremy Height, and I'm a chiropractor and owner at Midwest Chiropractic and Wellness in Eden Prairie, Minnesota. Today I want to discuss what do we do for treatment and therapy of neck pain in our office. There are different therapies that have been proven effective for neck pain. It is our goal in our clinic to find the most effective, the safest, and the most tolerable treatments for a patient. So the therapies that I'm going to show you today, we actually use kind of a combination to bring them together to make sure that we get a couple goals for the patient. Number one, we want to make sure that we get patients out of pain, and we want to do that as quickly and as effectively as we can. We also want to make sure that those tissues that have been injured, we're able to get them healed up. And then we want to get a patient on some sort of exercise program to stabilize the spine, to make sure that we have more strength around those vertebrae, to make sure that this is a less likely issue to come back. So no matter if a patient is dealing with a kink in the neck that they just woke up from, that's going to respond really quick, up into a disc herniation that is more severe, that is causing somebody a lot of pain, we're confident that we have the therapies in our office to help you, to get you out of pain, and to do it effectively. So the first part of treatment that I'm going to show you, it's called Flexion Distraction, and the goal of this is to distract those joints in the neck, really to stretch them out. We're also going to relieve that pressure on any tissue that has been injured in there. And then the other very effective, important reason that we use this therapy is it creates actually a pressure in the disc. If we have a disc herniation, that's going to suck it into the center and really decompress that part of the spine. This is a nice and gentle therapy that patients really tolerate well, but it's really effective, so we can target the injured tissue in there and improve the range of motion in those vertebrae. So I'm just going to contact the spine right here, lift up on those vertebrae, and there's a nice easy distraction right here. And this distraction force, it's kind of all under my pressure, so I can use, in the more severe cases, just a nice easy 2 pounds of pressure, and I can use up to about 6 pounds of pressure on patients that we really need to relieve some of that pressure in there. So we're just going to kind of do this nice easy pumping action. It really also helps with kind of pumping the inflammation and soreness out of there if a patient does have some of those soft tissue injuries in there. So we're going to go through a couple sets of this here. We usually do 3 sets of 5 just to get that nice good range of motion, nice good stretch of the neck in here. And this typically allows us to really get those soft tissues in the neck healed up and relieve that pressure on there. We usually wait about 10 seconds and then we'll go right back in there again. It's a nice easy distraction in there. That feels all right there?
Yeah.
Good. Okay. So we usually start treatment with that type of therapy right there. And we also have the option, if we have more of the upper back issue going on there, which we definitely see very often and very frequently, we're actually going to use these straps that are known as cervical straps, where we just kind of put them right across the base of the neck to use that distraction. And we're going to drop this down nice and easily right here. And then we can get a nice good stretch right in the spine for that upper back right there. Once again, this is just going to help us improve the range of motion throughout the neck and that upper back to get a nice good stretch. And with this type of therapy, what we're actually able to do is we can focus on this upper back area, which we see is a lot of times causing a lot of patients neck pain and decreased range of motion in there. And then as we get into therapy, we can actually use a little bit of, it's known as lateral flexion, kind of tipping that neck to the side, and a little bit of rotation in here. And the interesting thing with this one is a lot of times when we go down the spine, we can actually feel that vertebrae that's restricted right there. And patients like this, because we typically do get a vertebrae that they can feel that's tender in there, that typically is causing their pain. So as we go through this range of motion here, we can actually improve that movement in there, but that tenderness starts to decrease. And you can see this is just nice, easy, gentle for the patient. You're doing okay right there?
Yep.
Good. And we can work through every single one of these vertebrae in here. This is one type of therapy that patients really feel really good with. They very often just mention just the relief and the nice stretch that they get. This is such a tough area to stretch on our own, and with every patient that comes in, we're going to give exercises that you can do at home, but it's just a really tough area to stretch yourself. So just kind of using this table with these straps and these range of motions really help to improve that area. Even if we do have like a disc issue down in there, if we're getting anything into the hand, we can just really focus on that area to really decompress that part of the spine. So that's one of the other therapies that we can use for the neck. We're just going to bring that back to normal right there. We're going to take these straps off. The other type of treatment that we use pretty frequently is the spinal adjustment, the chiropractic adjustment. And what we're going to do is we're just going to have a patient go ahead and take a breath in here and all the way out right there. A little bit of pressure. Good. Okay. We'll breathe in here and all the way out right there. There we go. There we go. Nice good movement in there. And then breathe in and all the way out right there. Good. There we go. Good. Nice good motion in there. And that adjustment, we really want to use it because a lot of times what we're finding throughout the spine is those restricted range of motion, especially those individual segments. Sometimes it's a couple of segments that really get restricted in there. And when those vertebrae are not moving, that leads to a lot of different pain throughout the spine. It can kind of cause some pain into the shoulder right there. So I'm going to have my patient go ahead and flip over onto her back right there. And we can use the adjustment for that mid-back. We will also adjust the neck just to improve that range of motion in this area. One other thing that we do have the option to do too is if a patient is having some muscle soreness or muscle strain, especially working at a computer or any accidents or anything like that, we can actually just grab some lotion and we'll start working through those muscles in there just to relieve that pressure right in there. And then the last thing that we want to make sure that we're doing is we're going to give a patient home exercises. And we're going to start with a plan that starts getting some range of motion in the neck and allows the patient to get some movement. But then we're going to also finish with strengthening exercises. These are called the deep neck flexors. And basically what their job is to stabilize the spine. So we have that support to take that pressure off the majority of the spine. So we're going to get a patient on, these are deep neck flexor exercises. They're nice and easy. The patient is just going to lay either on the floor, we have her on the table right now, and we're going to have the patient lift their head up about an inch, and we're going to have them hold their head like that. So females should be able to hold this for about 30 seconds and males should be able to hold this for about 45. But what we typically see with neck pain is we do get some of that shaking, and the stability is something that it takes a while to improve on that. Go ahead and relax right there. We won't do the whole 30 seconds, but you can see those exercises are one that as a patient you can actually feel those muscles starting to really be worked in there. And that stability is such an important factor in there. So these are just a couple of different options that we have in our office. Like we said, we're looking for the most effective, the safest, the most well tolerated, and these are all for the patient to make sure we get you out of pain and we make sure we get those good results. So if you do have any questions, go ahead and give our clinic a call. We are at Midwest Chiropractic in Eden Prairie, Minnesota.